adversity really kind of like, it turns the heat up,
Yeah.
and you either burn in the flames or you keep going. So one of the biggest things in life that holds people back is fear,
Yeah.
right?
Agreed.
Fear, the unknown,
Yeah.
right? It is a very real thing because, it's very scary. What if I fail, right? But I think my biggest fear is, what if I stop right now and I never become the person that I have envisioned, right?
Yeah.
You have to see it first in order
Yeah.
for things to be successful. You have to believe it when nobody else believes you.
Yeah.
You know?
Agreed.
And that's the strength that you get every day. Nobody sees your wins except you.
Welcome to the Athletic Dry Needling Podcast, the show where rehab meets real talk, hosted by Dr. Scott Dixon. Every week, we dive deep with physical therapists, chiropractors, elite athletes, clinic owners, and performance innovators who are absolutely crushing it in their fields. This is where movement, mindset, and muscle meet.
All right. Welcome, everybody, to another edition of the Athletic Dry Needling Podcast. I'm here with a good friend of mine, Jonathan Casero, an AT who is crushing it down there in Miami. Thanks for coming, buddy. I appreciate it.
Thanks for having me.
Yeah. So I have seen your journey since I first met you in that class, man. You've been crushing it. So kind of tell me, and don't skip any details, on what got you to where you are to own your clinic. I know we spoke a little bit a couple weeks ago, but
Man, how much time do you have?
I've got all night, man.
Well, it's been a long journey full of ups and downs, but
Yeah.
everything worth fighting for is always it's going to be an uphill battle.
Yeah.
So I'm very fortunate to still be here and keep doing it. So
Right.
a little bit about me, my background. Graduated with my master's in athletic training in 2011 from FIU.
Okay.
I had a short time interning with the Dolphins in 2010, right before I got my master's. So I was a summer intern. That was fun. Got a lot of experience from that. And then from there, when I graduated, I spent a little bit of time with the Texas Rangers.
Oh, nice. Okay.
I worked the Dominican Summer League. I was the assistant athletic trainer there,
Okay.
which was really cool because you go from the NFL, where you have everything at your
Right.
disposal,
Right.
to the Dominican Summer League, where, if you're not familiar, you have Major League Baseball, Triple A, Double A, Single A, and then you have the minor league baseball. Every
Right.
major league team has a complex over there, and that's where they get the Latin prospect.
Oh, so you were down there. You went down
Yeah,
there? Oh, that's
yeah.
awesome.
I
Yeah.
lived in the DR for about 4 months.
Oh, that's awesome.
It was
Yeah.
really cool. So, you're in a third world country with barely any resources.
Yeah.
The local hospital is like 30 minutes away. So basically we were kind of like all things medical, general medical, orthopedics, literally. We were the ones taking care of everything. So it was cool. It
Okay.
was, and I definitely got a chance to kind of, think outside the box a
Right.
lot,
Yeah.
right? So with those opposite ends of the spectrum, I definitely got a lot under in my tool belt.
Okay.
And then I came back to Miami. My first actual position was, I worked for a PT clinic,
Okay.
and while I was with the PT clinic, I basically fulfilled their athletic training contracts, right? So I was
Right.
assistant athletic trainer for the Fort Lauderdale Strikers, a
Okay.
local pro soccer team down here. Now they're Inter Miami.
Yeah.
So I worked with that for 2 years, and then I was a head athletic trainer for a private school.
Okay.
And then I would kind of like float around in the off season at the clinics, 3 different clinics there to help out with all the patients.
Right.
So yeah, I did that for about 2.5, 3 years, and then
Okay.
the private school hired me directly, right?
Okay.
So I was a full-time head athletic trainer for an elite private school that they had an elite football program, an elite basketball and soccer program. So
Okay.
from there, university school, NSU University School,
Mm-hmm.
um, I worked there for 10 years.
Oh, wow. Okay.
And yeah, and through taking care of all these young elite athletes,
Right.
eventually they turned into professional athletes.
Right.
And even during college, they would come back and see me, and they would be like, Doc, like we only trust you.
Yeah.
Even like guys at D1 schools, they would always come back and they're like, man, like nobody's like you, man.
That's
Because
awesome. Yeah.
I would take my time with them, and
Right.
I would listen to them, and they would be heard, and it's different when you have to take care of like 80 guys versus
Right.
you get that one-on-one treatment,
Right.
right?
Yep.
So yeah, that's how I started
Okay.
my own thing.
All right. When was that
Because
time frame roughly?
so this was December 2019.
Okay.
I actually started branching out on my own. I was still with the high school, but
Okay.
I did have some free time,
Yeah. A
and
little
actually,
side hustle.
yeah, a
Yeah.
couple years before that. So I actually really started doing house calls for pro athletes around like 2016, 2017.
Okay.
So I was doing NBA and NFL guys.
Okay.
Shout out to my guy Stan Remy. He's a NBA skills basketball trainer down in
Okay.
South Florida. Is one of the best ones down here,
Oh,
and
that's
he was actually one of my first clients.
okay.
So I would take care of him, and then he would shoot me a bunch of his NBA guys, and then little by little, with the guys that kind of were homegrown for me from the high school pro athletes, I just started getting busier.
Right.
So my wife was like, "Hey, you should probably start your own business." I'm
Yeah.
like, "Hey, you're probably right."
Yeah.
So yeah, so I kind of developed a rapport within the community. Everything was homegrown, organic, and
Right.
I saw an opportunity where I was able to rent space from a sports-specific training facility, a couple of gym owners who would train a lot of my athletes,
Right. Right.
right? So, um, and they were kind of elevating the same time I was elevating,
Right.
and they actually like they were moving into a bigger location, and I saw my opportunity to kind of like move in there as well, kind of
Okay.
rent some space.
Yeah.
And then, that was December 2019 when I officially, got my LLC and I did everything
Now, did
the
you
right way.
completely cut off from the other place? You went
So,
all in?
so crazy story, right? 2020 rolls around.
Oh
I'm
yeah,
I'm
cool.
actually I'm actually booming, right?
Yeah.
From December to March, everything's great.
Right.
I still have both jobs, but like my clinic is kind of pulling me more
Right.
towards, the private business,
Right.
and all of a sudden COVID hits, right?
Yeah.
And then we shut down for 2 months,
Okay.
and then we reopen in May.
Right.
We're forced to have everybody wear masks, and a couple months down the road, still trying to pick up the pieces. My wife actually suffers a stroke hemorrhage
Ugh.
July 2020,
Oh my
right?
God.
So it was insane. So she ended up needing like brain surgery,
Ugh.
at 30 years old.
Ugh.
So the new business,
Yeah.
battling COVID,
Ugh.
and then my wife had a stroke
Ugh.
hemorrhage. Turns out she had a brain tumor, so that's what required her
Right.
to get a brain surgery. But and she was paralyzed. Half her body was paralyzed for 6 months. So I actually
Yeah.
had helped her kind of walk back,
Yeah.
get back into walking, and she had to
Ugh.
relearn everything. It's like somebody hit a
Yeah.
reset button.
Yeah.
So 2020 was a rough year, but fast forward to 2021.
Yeah.
My wife started being more independent, and then I was able to kind of hit the ground running, and that's when I left my private school job and was full go from there and never looked
So
back.
so I want to go back because I remember the first time a couple weekends ago is when you told me about your wife, man. It just broke my heart, man. I can imagine what you were experiencing
It was
as a
crazy.
husband, man. That's so painful. Obviously, you know my story, which we won't go into. I mean, that's tough
Right.
to watch
Yeah.
somebody you
Yeah.
love. So
Super tough.
you had her, which basically needed you almost all the time. You were doing the high school or the private
Hmm.
school, and you were doing your own thing.
and I was doing my own thing.
That's
At one point,
insane.
yeah, at one point before she had the stroke, I had three jobs.
Oh
It
my God.
was my own thing. Then I worked part time for Baptist Hospital.
Okay.
I was kind of like a third party vendor, so any extra events that they had on the weekends, I would do that if I
Right.
didn't have clients, and then I would work the private school. But luckily for me, 2020, I mean, you know, the good thing behind that is that all the sports were canceled,
Yeah.
right? So there wasn't much for me to do except doing stuff from the house.
Right.
So I was remote most of the time, and that kind of allowed me to really
Oh,
focus
nice.
on my
Okay.
private business.
Right.
So 2020 was a gift and a curse at the same time, but
Right.
you kind of see your opportunities, and you have to kind of deal with what you have.
It's funny. I'm listening to a book the other day, one of Malcolm Gladwell's Outliers, and one of the things it talks about is it's obviously the right person, the right place, and then the right circumstances. Like it, you had to be. You could have all the brains in the world, but you had to
Hmm.
be. Things in the world just had to happen at the right time. Like I don't know if you would
Right.
be where you were if COVID hadn't hit, or if your wife had. I mean,
Yeah.
it everything just kind of fell into place. Not a shitty way to get there, right? To have to deal with
Absolutely.
that, but
But adversity really kind of like, it turns the heat up,
yeah,
and you either, you burn in the flames, or you keep
yeah,
going.
right.
So, I saw it as that I had no other option but to succeed, whatever that looked like.
Well,
So,
what I respect about you too is we especially in our society today, we see a lot of people that get adverse stuff and then they go down. I think there's an old quote that like when you face adversity, that's truly defines your character. And I know from experience of knowing you, but it sounds like
hmm
this really said, "Hey, who are you really, and who can you be?" And you said, "Watch this." You know,
100%,
that's
100%.
freaking amazing. That's so amazing.
Thank you.
I don't know if I
Thank
could
you.
handle all that. So
It was crazy, man. And
yeah,
it was really crazy because I had already made a decision that I was going to leave my job, right?
right,
Of 10 years. I was very comfortable,
yeah,
salary and everything, benefits, 401k,
right,
everything. But I really, like it's true what they say. You really have to, you have to see it first in order
yeah,
for things to be successful. You have to believe it when nobody else believes you,
yeah,
you know,
agreed,
and that's the strength that you get every day. Nobody sees your wins except you.
right.
And it was crazy because I it was a fork in the road, because when I was leaving my job, there was actually an opportunity for me to get a better job as
Oh,
a head athletic trainer for one of the high schools, like,
okay.
uh biggest football schools
Oh wow,
in Florida. Like,
yeah,
they have one of the most NFL, like, high school athletes that have
yeah,
gone to the NFL is from that school.
right,
and and I had the opportunity. Like, the athletic director, the head coach, they all loved me. They're like, listen, like, like, job is yours if you want it. And even then, I was like, wow, really, yeah, I love that. But I had already made my logo,
yeah,
and I was like, honestly, like, there's no other logo I want to represent but
yeah,
my own.
yeah.
So,
You
and
were
I'm
committed, like you said. You already saw it, but
yeah.
yeah.
So it's like, no, I respectfully decline, but thank
All
you for
right,
the opportunity.
yeah.
And
Now, were
5
you a
years later.
tad, especially just for so the people listening, because you and I know this as well. Your wife's doing good now, right?
Hmm.
Excellent. Yeah, and she's
Yeah,
pregnant.
absolutely.
She,
She's pregnant. We're about to have a
excellent.
baby, first boy.
Excellent. That's awesome. I just want
Yeah,
everybody to
things are
know
amazing.
that she did okay and she's doing well.
Yes. Yeah.
So,
Hmm.
but it's you really had to say, man, this is. I mean, were you nervous? Were you like, man, I got a wife? Were you just said, I'm doing this no matter what? Was there a part of you that was like, man, what if, the voices in our head, what if it doesn't work? What if I fail? What if I,
So one of the biggest things in life that holds people back is
yeah,
fear,
yeah,
right?
agreed.
Fear, the unknown,
Yeah,
right? And it is a very real thing
yeah, oh,
because
yeah,
it's very scary. What if I
right.
fail, right? What is, like, the worst case scenario? But I think my biggest fear is it if I what if I stop right now and I never become the person that I have envisioned, right?
Yeah. I
Like
like
that's my biggest
yeah.
fear of
Yeah.
not being that person that I
Yeah.
envisioned versus the failure.
Yeah.
Like I'm striving to be, the best version of myself and actually kind of leave a legacy behind me.
Yeah.
So
It's
you just
amazing
got
how many like clinicians I talk to across the country that are like, I mean, I hear as soon as I talk to them 5 minutes, I hear the yeah, but, oh, I want
right.
to go on my own. I want to do this. I'm like, yeah, let's do it. I got you. Go. And they're like, yeah, but, my this or by that. And I'll have to send it to you because I always talk about my podcast. What changed me, there's a little Steve Harvey thing that he did after Family Feud, and it's called Jump. And it's
Mm,
real. It's like 6 minutes long. And I'm like, I watch that. And I'm like, dude, I'm jumping. Because if you sit there on the cliff and you're like, look at that guy, what he's doing. Ooh, look at that guy, what he's doing. If you don't jump, you're never going to know what the world has in store for you. It's
it's one
scary,
Yeah, it's
right?
very scary. But
But
it's one of
people
the most
justify it. They're like,
one of the most
well, what about my credit? Or, I got family or I got kids. I'm like, dude, you're letting your kids down if you don't do it, right?
100%.
If they grow up and go, man, my dad chose comfort or safety versus being
Right.
the, like you said, the person that he could be, you know?
100%. Yeah,
So tell me a little bit about because I want to talk about your practice.
okay.
So yeah, tell me. I went on the website. Look at this. I love the videos of the treatment.
Thank
And
you.
again, I've seen you treat. I know what an amazing clinician you are. Obviously, I tell people all the time when I do these podcasts, you can meet NFL players or pro athletes, but if you don't freaking deliver, it doesn't matter.
Doesn't
I mean,
matter.
you have to deliver.
100%.
My journey was the same thing. I got one opportunity to treat one guy and blew him away, and then that kind of led me to where it was. So, tell me kind of your treatment approach or your mentality as a clinician.
Yeah, absolutely. So, for everybody listening, it's so my nickname has been Doc
Yeah.
for since my first year working football, and the head coach gave it to me.
Okay.
Um, and I was like, look, I'm just an athletic trainer. I have a master's. I'm not a doctor.
Yeah.
They're like,
Yeah.
no, your name is Doc.
Yeah.
Okay.
Okay.
So it kind of stuck with me. Everybody
Yeah.
knows me as Doc. Some people don't even
Right.
know my real name. They just know me as
Right.
Doc.
Okay.
Right. So I turned that into my business, and now it's Detailed Orthopedic Care,
Yeah.
DOC.
With a
Right.
kick-ass logo, by the way. I
Thank you.
love your
Thank you.
logo.
Thank you. I
Yeah, it's
appreciate it.
so Miami, and it's
Yeah,
so you.
absolutely. Wow, for
It's
sure.
not. If anybody's ever met you in person, conservative is not you. Yeah, that's awesome.
VOC,
Like
baby.
it's
Yeah.
you. I remember just the other couple weeks ago walking. You come in and like exactly the outfit I expected you to wear, man. Right?
I never leave the house
You got
without
me beat
matching.
on fashion, man. I couldn't even. I wear the same stupid polos all the time. I wish I could dress like you.
Oh, I
Right?
appreciate that.
Yeah.
Yeah,
So
man.
you were talking about. Tell me a little bit more. I know you guys are one-on-one, right?
Yeah. Yeah.
What
So
does a typical session include as far as treatment?
so we do rehab and recovery, right?
Okay.
Recovery is huge now.
Oh yeah.
But like I feel like a lot of business people go into recovery and they just offer machines that you
Yeah.
can put them on, right?
Yeah.
Versus having an actual clinician going in and actually giving you a full body recovery session, top to bottom, whatever your problems are, ailments, trigger points, stuff like that. We use a lot of manual therapy.
Hmm.
Also, we have that medical background, so if there's any type of muscle imbalances or anything like
Hmm.
that, we put you on a corrective program as
Good.
well. And we have a 12,000 square foot facility that we're in right now. So we have all the bells and whistles outside where we can do a full round of therapy.
Right.
But we specialize in manual therapy,
Okay.
which is the instrument assisted tools, the cupping, BFR, and of course dry needling. Thanks to
Right.
you.
Yep. Yeah.
Yep.
How are it's one of these funny because I printed up some questions. I told you probably wouldn't get to them. One of the things I like is how do you incorporate dry needling into your typical session? When is it in your brain as a clinician? When do you go dry needling versus cupping versus soft tissue? When is
Right.
it really your go-to?
So my go-to non-negotiable, unless they have like a huge fear of needles
Yeah.
or that like they have a history of passing out, um, which
Right.
happened to me once.
Oh no.
Yeah. But if they're okay with me
Yeah.
needling, non-negotiable would be an acute injury for sure.
Okay.
Recent muscle strains,
Yeah.
sprains, any type of acute inflammatory conditions, we do that immediately. And we've seen, I see tons of hamstrings, especially
Right.
during
Oh,
combine training.
yeah.
We have a combine program, so I take care of all the athletes, kind of keep them going while they're in that intensive 12-week program.
Yeah.
A lot of hamstrings start going around week 8,
Yeah.
week 9. It's just that fast athletes are really tight, right?
Right.
So the needles definitely help out, and it's a faster recovery time.
Right.
So acute injuries, one for sure, 100%. And then also any type of chronic, any type of tendonitis,
Right.
inflammation of I see a lot of rotator cuffs, patellar tendonitis, um, lumbar issues, cervical issues.
Right.
So, that chronic pain that kind of doesn't go away, we
Would
treat
you
with
would you
with the
say it's
needles as well.
almost every session they're getting needling on
I would
most days?
say I would say almost every session,
Yeah.
um, there is some type of dry needling. Sometimes I'll see clients maybe like 2 or 3 times a week.
Right.
So, or maybe for some people it's just once a week, depending on
Right.
what they have time for, or what the goal is, right? But yeah, dry needling for sure is a huge help on their on one, pain management, two, the just to help speed up the recovery process.
Right.
100%.
So one of the things, obviously, I know this one because that's 90% of what I do is needling. But what are some of the misconceptions about needling that you hear from patients? And then how do you overcome that as far as effectiveness and safety? You know, do you have patients
So
come in and go, well, I heard it's this, or what are some misconceptions that people have?
a lot of people misconceive it, and they think it's acupuncture,
Yeah.
right? So I
Yeah,
have to
that's the big,
educate them.
right. Yeah.
Like, it's not acupuncture, it's dry
Right.
needling. It's actually
Right.
research based.
Yeah.
Actual clinicians are being able to be certified in this. This is I always tell them, especially I have a lot more general population over professional athletes
Agreed. Yeah.
clients. Obviously, they keep me afloat. I only see these pro athletes, in the off season, and
Right.
then during the season maybe a few. But they have their people. So yeah, I tell them, like, look, this is the stuff that the pros get. You
Right.
know what I'm saying? This is
Oh, that's a good selling point. I like that. Yeah.
yeah, yeah. So they're like, oh, really? Tell me more. So and then another big deterring factor or misconception is that, oh, it hurts a lot,
Yeah.
right?
Yep.
And sometimes, obviously, like, the more you do it, the better you get, and the techniques that you showed me,
Right.
like, sometimes they don't even feel it,
Yep.
and they're like, oh, it's not that bad anymore, like, I thought it was gonna be worse. So
Now, what I like about you, I think you do the same thing I probably do because you're so good at needling. Have you had the patient come in there and go, oh, I've had needling. I didn't like it or it didn't work? I love it when they say that because my brain goes, no, you haven't, right? You haven't had needling, right?
right,
Have you seen that clinically?
100%. Even
Yeah.
pro athletes, they're like,
Yeah.
"No, I did that one time. It really hurt. I don't like
Yeah.
it. This and that." I
Yeah.
said, "Listen, let me do it.
Right.
You don't like the person that did it probably, did it wrong or had a different technique,
Right.
or they weren't as cautious or careful to, like, look, let me do it. Just if you don't like it, we won't do it again." And then I do it, and they're like, "Wow, that's completely different."
Right.
And I'm like, "Yeah, sometimes it's the clinician that behind the needles that
Oh God,
really
yeah.
is
It's
effective."
everything. One of the quotes I always tell my patients, and you feel free to borrow this. I think it's from an old 1920s book, is where a guy comes in and he looks at a machine that was broken, and he walks up and down and he finds a spot and he taps it with a hammer. He bills them the next day $1,000. And they're like, "What? $1,000?" He says, "No, tapping was $1. Knowing where to tap was 999." Right? Because
Hmm.
it's lots of
Absolutely.
people can needle, but it's knowing where to needle for
100%.
efficacy. So let's go back to
100%.
the business because we get a lot of listeners that are really, like I said, trying to make that leap. We talked about the COVID, talked about what your wife was going through. As a business owner, what were some other hurdles that you're like, oh, I didn't know that, or oh crap, or what have been some of the speed bumps that have happened along your journey from a business side?
Uh, man, you really have to have thick skin to be a business owner, really.
Yeah, right. Sounds
You're
like you've had a
so.
few hurdles, right? Is what I'm guessing.
Oh man, the hurdles don't stop.
Yeah.
I'm a track athlete. It's crazy, man.
Well, if anybody knows you, though, no offense, you're not built like a hurdler.
No, no, I'm not. I'm
Okay.
not. No, but
Yeah.
no, it's really you have to believe harder
Yeah.
than anybody else can, and sometimes you will have slow months,
Right.
right?
Yeah.
And then like you'll have uh like a little bit of a drought,
Right.
right? And then you probably won't see as much money coming in, and all of a sudden it comes in by the boatload, right?
Right.
So it's always kind of
The ebbs and
a
flows.
dip, ebbs and flows. So you just
Yeah.
have to be prepared for that, because it is scary when it is kind of like on a dip. But
Right.
I'm at this point, 5 years in, I'm nothing really like rattles me anymore,
Right.
right?
Well,
Because
would you say at this point you're pretty consistent, or are you still seeing ebbs and flows?
no, right now actually, I'm blessed. I am
Yeah.
pretty consistent right now.
Good.
Book 2 weeks ahead, on average.
Nice. Okay.
So now
Great.
now I have two clinicians under me,
Yep.
which just got certified by you.
Yeah. Yeah. Great guys.
Yep.
Shout out to those
Yeah.
guys. They're awesome. Right.
Stephen and Tyler. Yep.
Yeah.
So one is a physical therapist and one's a chiropractor. Both are actually athletic trainers as well.
Oh, nice.
So,
Yeah, it's
yep.
very rare. I haven't seen a lot of DC ATC.
Yeah. Yeah.
That's a
It's super
very
dope.
unique combination. I love it.
Yeah. Yeah. And he's actually pretty cool. He's got he worked with the Jets a little bit,
Okay.
um, a few years back. So
So
he's
from
got
other
NFL
than,
experience.
the ups and downs of patient flow, what have been some other challenges like, from a bookkeeping, from a how to run, how to market, did you do any courses? Did you follow anybody? Did you read any books, from the business side of it? Because a lot of us, that book, The E-Myth, it's a really good book. If you haven't read it, it's like
No.
we're skilled laborers and we go to open a business and we're like, we're not business people. So
Right.
that's what a lot of clinicians like, dude, I'm the best PT or the best ATC. And they're like, no, I actually have to be a business owner. So from the
Absolutely.
business side, what was some of the biggest hurdles of learning and going, oh, I should have done that differently. I should have.
Well, I'm still learning, and the best thing to do is, to never think that you know it all, because
Yeah. Oh, yeah,
that's
no
when you
doubt.
stop learning, or that's when you start declining. So, you definitely have to be able to wear a lot of hats.
Right.
Marketing, bookkeeping. Thank God I have a great accountant. He
Oh,
helps me
good.
with
Yeah.
that on that end. Having a
How
great
soon did you
accountant
bring
really
that in?
helps.
I mean, was that right away?
Right away.
That's,
Yeah.
that's smart.
Yeah.
Okay.
Right away.
Yeah.
Um,
What
yeah.
about
That's
admin people? Have you brought in any admin?
not yet. I'm actually planning on hiring as soon as we have our baby. Things kind of
Okay.
settle in.
Yeah.
I'm gonna bring in an admin for
Okay.
sure to be able to
Yeah.
handle the front desk. Because so far, I mean, at this point, my wife has been the admin,
Oh,
right?
nice. Okay. Now,
Yeah.
is she back to
So
work full time? Is she back working or no? Or
so
did
she
she
is
go
this.
back after the?
She's actually disabled, right?
Okay.
Yeah. She had she's been disabled since it happened, but
Yeah.
I mean, she's been doing a bunch of therapy.
Yeah.
She was actually doing a ton of physical therapy up until she just got pregnant. But
Okay.
yeah,
Yeah.
so
So
her
she's
her main
basically
job is
she's the
she's
woman
gonna
behind the business.
she's behind the
Yeah.
business. She helps me out a lot on the back end.
Excellent.
But now she's gonna have a full-time job as a mom.
Yeah.
So
Oh, that's awesome.
um
Tell me her name
yeah,
again.
Veronica.
Veronica. Shout out to Veronica. Thank you so
Shout out to
much. Yeah.
Veronica. Yeah, absolutely.
Yeah.
So yeah,
Doesn't
but
seem like you would be where you are without that
no,
motivation,
absolutely not.
inspiration, and help.
100%, 100%. She definitely kept me motivated
Yeah.
when I saw her at her lowest. So,
Yeah. Oh
kept
God.
me going.
Still breaks my heart. And now
No,
you have
man.
another motivation. Now you got
Yeah, absolutely,
a baby you got to provide for. So I don't know if I've
absolutely.
mentioned this on a podcast before, but I was doing a side hustle as well. I got lucky. I had a friend of mine that let me do like 1 day a week at his clinic and through et cetera. And the day I completely left this clinic, I was seeing like 20 a week. That next week, I had two scheduled. I'm like, crap, you know? Like, I'm like looking up the
Yep.
number for welfare, and I'm like, great. I got 2 little kids. What are the places where they serve food for free? Like,
Yeah,
we're
right.
going to be in line. Like, I went from 20 to 2, and I'm like you said,
You're like,
crap, you
yeah, it's
know?
crazy.
But it was
It's
tempting.
crazy.
Like you talked about, it was very tempting to call my friend and go, hey, can I come back? But like you said, hey, I believe in this. And, I had a really good talk with my buddy Kyle down there in your area, Kyle Crew. And I said, yeah, what would you say? Because I've seen this pretty consistent in different variations across business owners who are doing it. If you had to give me a few descriptive traits, like what would you attribute your success to, whether it be luck or skill or resilience or, whatever, what words would you describe if somebody's going to be a successful cash practice owner? What do they need to have? Or what have you had?
A lot of self-discipline,
Discipline.
um,
Okay.
a huge amount of insane amount of belief in yourself
All right.
when
Yeah.
nobody else
Yeah.
believes
I
it.
like that one. I haven't heard that one before. I like that. Seeing the vision.
See,
Right.
you have to see the vision. You
Okay.
have to
Yeah.
see it before it happens,
Yeah.
because if not, you'll crumble.
Right.
You gotta have thick skin.
Yeah.
Can't you know can't hear you can't believe what anybody else thinks
Yeah.
about what you got going on. And I mean, obviously, you have to be really good at what you do as
Yeah.
well,
Yeah.
right?
Yeah.
Be-
Yeah. That's
but
probably the biggest one.
just because you're a great clinician,
Yeah.
obviously doesn't make you a great business owner and stuff like
Right.
that. So you do have to, but at the same time, because it's I have a couple of friends of mine that they're athletic trainers as well, but they've hinted at trying to start their own businesses
Okay.
as well, but they
Yeah.
haven't done it yet, right? And they actually went to go get their doctorate in athletic training, and because they have a uh, a business course in
Okay.
that
Okay.
program, right?
Mm.
But it's sometimes you know like you can't find, you have to kind of like just experience it yourself.
Yeah.
You
Yeah.
have to figure it out on your own,
Yeah.
right? There is no book that's going to tell you, at at this at
Right.
this point you need to do this. You have to kind of figure it out,
Yeah.
and the
I
best
like when
the
I'm when
best
I'm when I'm giving people advice, because I always like when I'm out there and like, hey, how did you do? I can tell that they're looking at me like, oh my God, you're so smart. I'm like, no, I'm not. I've just fucked up so many times, right? I'm here because
100%.
I fell like 20 times,
100, like
Yeah.
Michael Jordan.
Yeah.
How many
Like,
missed
yeah,
shots
I
has he
missed.
had?
I mean, I look back and I'm like, ah. So on that note, if you could go back and talk to, Doc in 2021, is there any piece of advice say, hey, don't do this or do this? Any advice you'd give yourself when you started your business?
Well, one, I would tell him definitely just don't quit, don't give up,
Yeah,
just keep
right.
going. And I probably would have told them to raise his prices earlier.
All right. Step
Right?
one.
Because
Yeah,
step one, raise the prices.
yeah,
Because I obviously, like I was really torn when I first
yeah.
started, because I was like, oh my God, like, how is somebody gonna spend so much money on me,
Right.
right? And then you just have to know your worth,
Yeah.
right? And it's just like, going to a Mercedes Benz,
Right.
right? You're not gonna expect to pay what a Toyota would be cost for a Mercedes Benz, and at the end of the day, all the stuff that we've developed over the years,
Right.
the skills, that should speak for itself, right? So you have to really know your value, and you
Yeah.
have
When you
to.
look at, I've been reading Alex Hormozy's book, the $100 million leads, $100 million offers, and he's like, you don't want to get stuck in the commodity battle. Like this
No,
guy's cheaper, this guy's.
right.
I don't want the people that are looking for cheaper. And what I love is like, I'm not selling my services. I'm selling your ability to keep doing what you're doing. Can you put a
100%.
price on that? Right? Well, you're
100%.
selling dry needling. No, I'm not. Because if I'm selling dry needling, you could go down to Joe Smo. I think it's $50. I'm
Yeah.
selling your ability to keep playing pickleball or your ability to keep playing, especially, when you work with pro athletes. If they get one more year, that's more money than I'll make in probably 10 years,
100%.
So
Yeah.
you're not selling you're selling what they want,
Right. Yeah.
So what,
Absolutely.
if somebody's sitting here, because it's kind of cool, I've only know 3 people in the country And I've been traveling this country for years who are ATs that are doing it on their own. I know a lot of PTs. Obviously, Kairos, it's almost they get out of school. It's like start your own practice. That's almost what they have to do. So, what advice would you give to an AT that says, "I'm going to go out on my own"?
Honestly, it doesn't happen overnight,
Yeah.
right?
So
I
patience.
I
Yeah.
a lot of patience, a lot of patience, a lot of
Right.
patience, but a lot of networking.
Yep. Yeah.
Everywhere I go, I'm always, very. I'm like a social butterfly, right?
Yeah.
I literally
What?
talk to everybody in
No.
the room, talk to everybody in the room.
Yeah.
Hey, how you doing? And I get to,
Right.
just you meet so many people in these types of settings
Yes.
where
Yep.
you go to an ATA or early on I did all these internships
Yeah.
because I needed more like not credibility, but I needed more confidence in myself, right?
Right.
So I was like, you know what, I need to do this. I need to go here and learn as much as I can. And I picked everybody's brains when I was with the
Right.
Dolphins, and the same thing with the Texas Rangers, and everywhere I went, even in the PT clinic. So everywhere where I've gone, I've picked everybody's brains, and I've kind of developed my own
Right.
type of um, way of how to treat, how to become a clinician, how to become an overall healthcare practitioner, right? So I think that in itself kind of helped me give me the confidence in order
Right.
to start my own thing, right? And it took me 10 years to really kind of develop that networking and that rapport and kind of getting that trust from these
Yeah.
professional athletes. And it's just kind of like it's a snowball effect,
Right.
right?
Yeah.
So whether you're an athletic trainer, physical therapist, chiropractor, you have to be good at what you do.
Yes.
But especially with athletic trainers, the work setting that we're in um, is we're always kind of like taught to be working under somebody, right?
Yeah.
Because
Yep.
even our own accreditation, we have to have um, a physician,
Yep.
to sign off on everything,
Yeah.
a medical director, right? So, but with that, like you have to kind of like break out of that mold, and that's what I feel like I'm doing with starting my own business, and
Mhm.
eventually, obviously, when I get bigger, I want to
Mhm.
bring in more athletic trainers and
Mhm.
give them the confidence to kind of like do what I'm doing, right?
Right.
Because at the end of the day, chiropractor, physical therapists, or athletic trainers, we're all healthcare professionals, and
Yes.
there's a lot of merge, a lot of
Oh
overlap
yeah.
of what we do, right?
Mm.
And the end goal is your client, right?
Right.
The person that we're taking care of. We want to make them feel better. We want to give them the opportunity to get back on the field or get
Right.
back to playing pickleball or golf, right? So, and I love uh, you know, seeing everybody's journey because everybody's different. But at the end of the day, we're all passionate at
Right.
what we do with this healthcare, right? And
Right.
I feel like the healthcare system is broken. Anyways, you go to these PT mills,
Yeah.
right? And it's four or five patients every hour. You have these clinicians that are overworked, and you're giving these physical these patients these basic exercises that's
Right.
really you're getting the better to like about 80% of like back to activities of daily living, right? And that's literally um the minimal thing that you could do
Right.
according to being able to bill,
Right.
right? But as an athletic trainer, you're always kind of geared towards, hey, look, we need this athlete back on the field 100%.
Right.
So,
Yeah,
I
there's a
feel
difference
like
between going back to work and returning back to play, right?
100%.
It's a
Yeah.
huge
Well,
difference.
that's true. Yeah,
Yeah.
that's a huge difference. But
Yeah.
I mean, the other day, like, you want to give that person, whoever you're taking care of,
Yeah.
that ability to be able to like be active again
It,
and stuff like that.
it's
So,
funny. You just made me think of this. I wish there was some way, and maybe I could find some AI software. If I could go through all the podcasts I've done for business owners and see words, because I keep hearing the same things like passion, connecting. Like you're not going to be a cash practice business owner if you're an introvert. right? You got to love people. You got to be out there. And I mean, your energy is the same as mine, man. We're talking to everybody. We love people, and then passion, number 2, which everybody talks about. You got to love what you do. Like, I'm so lucky that I get to travel the country and teach amazing people. I love it. There's nowhere place I'd rather be. And then never stop learning. You got to be the best, man. I mean, it's literally stitched on the back of our company shirts, like I've taken 10 needling courses. I'm always trying to find a way to provide a better outcome for my patients.
100%. Yeah, absolutely. So every year I would do like a new certification. Dry needling was actually I think we weren't allowed to dry needle until recently, and then as soon as they lifted it, I jumped at the opportunities. I was in.
That's awesome.
So I was fortunate enough to for you to teach me, and definitely appreciate the.
No, I feel like I'm the lucky one, man. As I tell when I'm teaching, my best part of my job is the people, man. I'm so lucky to have such an incredible network, man. Yeah. So I appreciate you. I know you probably got to get to the missus. Tell her that you guys will be in our thoughts. I'm looking forward to. Please send me pictures. I'm excited. Sure, go crack those whips on those 2 guys. Make sure they become amazing clinicians like yourself. Doc, man, I appreciate you, brother. If you'll stay on for a little bit, we'll chat for a second.
Yeah, absolutely.
Man. Much love to you, buddy.
Much love.
This episode is brought to you by Fringe, where modern science meets natural healing. At Fringe, they're all about helping your body do what it does best, heal. Whether you're chasing peak performance or just need to bounce back faster, Fringe's red light therapy tools are designed to support recovery at the cellular level. Pair that with their clean, science-backed supplements, and you've got a daily wellness routine that actually works. Simple, effective, backed by research. Visit fringeheals.com and use code ADN15 for 15% off your first order. That's fringeheals.com, code ADN15.